Welcome to the AACS Daily News. The Attleboro Public Library recently hosted a Naloxone administration training for library staff and the general public. Dr. Jeffrey Bratberg, chairman of the Attleboro Substance Abuse Prevention Council, led the training.
So I was doing a naloxone training. I think that everybody is a first responder to our opioid crisis, and we have an effective antidote. It's completely safe. I think people have a lot of questions, and so I'm really engaged in the community, and as chair of the Substance Abuse Prevention Council, which we advise the mayor on efforts to help prevent opioid abuse and treat opioid use disorder and reverse overdoses that occur. That the more people that are trained, the more people know what to do, and hopefully the more people get equipped with naloxone. Yeah, everyone should have naloxone, because the Surgeon General said, and he's right now got more power than me. Implementing it is done through things like this, through community trainings, incorporating it into medical training and pharmacy training and nursing training, so first responder training at the police academy, the fire academy, making sure that everybody who is defined as a first responder or a healthcare provider, but anyone in the community can do it, because can be trained to do it, and should do it, because the more naloxone that's out there in Massachusetts, we actually showed that overdose deaths went down by almost 50%. The more naloxone that was in the community. So we have to educate the community. They've got to get equipped themselves, be comfortable to have it, and think about how to be safer themselves and how to keep their community and family and friends safe. So there's 3 ways to get it. It's currently still a prescription drug, but it's because of the life-saving nature of it, of other people. You can get a prescription for yourself. You can get from your prescriber. Anyone can prescribe it. You can go to a pharmacy and just ask for it through what's called a standing order, a statewide blanket prescription. And so you can go and just ask for it, and they'll run it through your insurance for you. Or you can look on the Massachusetts BSAS site and find out community programs where you can get naloxone for reduced or free. Average person should have 2 doses. So in the steps for overdose, I can do that in 30 seconds. You recognize the signs of overdose. They're blue, they're not breathing, they're snoring. You can't arouse them. You give naloxone either in the nose or in the muscle. You breathe for them. You make sure that they're breathing. If they aren't breathing, you give 2 doses. So you really only need 2 doses, and that's the number of doses that revive the most people in this country. I think people say, well, what if they do naloxone, and the first thing that person wants to do, because they're in withdrawal, which is why they're using to try to prevent, they may just run away. They may go use drugs again. My paramedic friends say that half the people they revive say, thank you, it's time for a change, and half the people say it's not. And so we have to keep using naloxone to keep people alive for what we call the window of willingness, to get people to say, okay, this is the time that I need to do that. And it's hard for people to process that, but if you show up to emergency room and just get treated, you're breathing, you're fine, leave. We don't do that in the Northeast in Massachusetts. We make sure that they're offered treatment and counseling and get the best treatment for their situation. Just search Massachusetts Department of Public Health, and all the resources are there.
That's it for today's update. You can catch all of our content on AACS.com, on the AACS Roku channel, or on the AACS mobile app.